Hello, hello. Welcome back. If you're a new follower, thank you for finding me and tuning in. If you're somebody who's been with me for a while, I appreciate you coming back for another video. Today, I want to talk about the differences between rheumatoid arthritis and osteoarthritis. It's a very common reason that a rheumatologist will see a patient because both conditions involve hand pain or wrist pain potentially, and other joints can be involved as well. Osteoarthritis is very common in the knees and hips, and also the back and neck. Rheumatoid arthritis, though, is what rheumatologists specialize in, and it's an autoimmune inflammation syndrome that involves the joint structure, typically in the small joints of the hands, the wrists, and can be large joints as well, also the feet. And what happens with rheumatoid arthritis is that your immune system, the part of our body that typically fights infection, starts targeting inside of our own body and our joints. Rheumatoid arthritis can also involve inflammation of the lungs, and this can be silent and tricky to identify. Sometimes we can see patients with lung inflammation as their very first sign of rheumatoid arthritis before their joints ever get involved. And it's helpful to understand the differences because when we offer treatment, it really does depend on the type of arthritis that someone has. Osteoarthritis is a common term for degenerative joint disease or wear and tear of the joint that happens in everyone. It's virtually inevitable. It happens as our body ages over time. It can also be accelerated after an injury, such as an ankle fracture or after a surgery. You can develop osteoarthritis as the natural healing of that joint and the bone. It's just wear and tear differently than it was before. And osteoarthritis commonly affects the far tip knuckles. You can find bony enlargement, or you can get tenderness there, feelings of pressure or difficulty sort of squeezing or bending your fingers. The middle joints here can also be affected by osteoarthritis, and then also the joint of the thumb. And people can describe stiffness that is typically more significant after you've been using your body all day. So if you're typing a lot or doing fine motor activity with your hands, it's very common to feel stiff and achy after you've been doing those activities at the end of the day when you're resting. Or when you first wake up, your body feels stiff and it just takes a little while to kind of loosen up and get your joints lubricated and your muscles going. And this is very, very common. So many of us develop osteoarthritis, and there's nothing wrong. It's really important to understand that this is just part of how our body changes over time, and it doesn't mean that there's anything bad or wrong happening to our body. But it can be bothersome and painful. Different treatment options can be injections if the knees are really painful. Oftentimes this will be offered prior to recommending surgery, and with the hips as well. Rheumatoid arthritis, however, though, is inflammation inside the joint that causes damage to that joint structure. So this, if it's not controlled, can actually be very harmful to the rest of your body. And prolonged inflammation throughout our body can lead to things like accelerated cardiovascular disease, early heart attacks, and like I mentioned, lung inflammation. And rheumatoid arthritis is very important to recognize early and start treatment, and to treat aggressively to get our patients into remission. And if you have a diagnosis of rheumatoid arthritis, I hope you're talking to your rheumatologist about what remission means to you and to your condition. Rheumatoid arthritis typically involves these knuckles here and also the middle knuckles, and sometimes the wrist can get tender and swollen. And this is a very warm, puffy, spongy appearance of the joint and difficulty moving or finding coordination to make your hands do certain things, like buttons or zipper, for example. So everyday tasks can become very difficult because it's not only painful, but your fingers just won't do the things you're trying to get them to do. And this can happen again in the wrists, where you have pain with backward motion of your wrist, twisting and turning, and then also if it affects your elbows, your shoulders, and so forth. So if you have concerns about the way that your hands feel in particular, or notice swelling in places that it doesn't seem like there should be joint swelling, and if this happens very quickly over time, over about 6 weeks or so, if you develop these changes very quickly. Osteoarthritis develops over time. It takes time for that to happen. But if you're noticing these changes, I urge you to talk with any member of your healthcare team to get a referral in to see a rheumatologist and talk about what your symptoms mean, because early detection is so important in how we treat rheumatoid arthritis. So I hope you found this helpful. And if you have any questions specifically about the differences between wear and tear arthritis, osteoarthritis, and rheumatoid arthritis, talking with your doctor is a great place to start. And that can then prompt more conversation about how to make you feel more comfortable, getting back to doing daily activities, things that you enjoy, exercising, living your life, and feeling better. Thanks again for joining me. We'll see you next time. Bye.